Here we start the part 2 of identification and management of emotional and behavioral problems. And here in this part, we will be discussing regarding the disruptive behavior disorders of childhood. There are five common disruptive behavior disorder of childhood can be classified in five categories. We'll also talk about the major target areas for each disorder, though we will find that there are some kind of overlaps in the actual behaviors that are displayed across the disorders. The five categories of disruptive behaviors are adjustment disorder, ADHD, that is attention deficit hyperactivity disorder, ODD, that is oppositional defiant disorder, conduct disorder, bipolar disorder. Their interventions are very much same because of the reason that there is considerable overlap between these disorders, and rarely there is a definitive diagnosis that is provided, and that is why generally they are labeled as emotional or behavioral disorders. Students or clients with mental and emotional disorders have been cited as among the most underidentified and underserved students with a disability. We have discussed that in part 1 as well. There are lack of resources and concern about the costs that the district or we can say that the authorities might incur. There is lack of access to mental health services for such kind of identified children and students. There is also stigma concerning the labeling of emotional disturbance and desire, I would say a strong desire to remove the troublesome children from the school because of the reason that they are not having any kind of real disability, but it just contributes to the overall low identification rates for children with mental and emotional disorders. So as I said that they are removed from the schools, so again their problems are not frequently reported and they are not referred to the mental health facility. There is some overlap that makes it difficult to distinguish a few of the emotional and behavioral disorders from bipolar disorder. For example, it's sometimes difficult to differentiate between ADHD and ODD because of the reason that in ADHD and bipolar disorder, there is distractibility, hyperactivity, impulsivity, restlessness, silliness, learning disabilities are also present, poor short-term memories there, as well as lack of organization. Similarly, the common symptomology of bipolar and ODD is bossiness, lying, oppositional behavior, deliberately annoys people, defies rules, blame others for the mistake, due to which these overlaps and commonalities, it becomes difficult to assign a diagnosis for bipolar or ADHD or ODD. The question is that why early recognition is required. Early recognition is required because if there is effective prevention of school failure required, it actually entirely depends on early recognition and provision of services for such children. Because as there would be more and more delay in identification, it would result in intensive problem of the children. They would aggravate, as well as it would be difficult to um, school them in a particular school. In part 1 of the lecture slides, we discussed the characteristics of emotional behavioral disorders. Those characteristics can be divided as shown on the slides, and this may help in recognition of client students with emotional or behavioral disorders. Emotional category characteristics can be divided in or can indicate anxiety disorders, mood disorders, oppositional defiant disorders, conduct disorder, and schizophrenia. Behavioral characteristic can be externalizing behavior and internalizing behavior. We have already covered that. Cognitive and academic characteristics. For instance, there are more than half of the students, they also tend to have learning disabilities when they have EBD. And most have receptive or expressive language disorders as well. There are a few cues that help us identify if the child may be having EBD. For instance, the child may be withdrawal, avoidant, insecure, or very much self-conscious, or anxiety, excessive worry or preoccupation may be there. Excessive motor movement. We need to also check for the cues regarding the problems with the relationship with the peers or the teacher, attention related problems, poor comprehension, lack of empathy, manipulation, attention seeking behaviors, perception of reality, rituals, obsessive compulsive behaviors and rituals, problems with authority figure, teachers, staff members, principal, or parents as well. Persistent complaint of being ill, blaming others for their own mistakes, regressive, and tend to act like a child younger than his or her own age, depressive mood, self-destructive ability, risk-taking behaviors, and physical change that may be in form of weight, sleep, interaction, or appetite. It is often said that determining is a cause that leads to intervention because it helps us understand that where the problem lies. And it is important to understand the difference between biological and environmental influences. Two main causes could be biological and environmental. Biological, something genetic that comes from the parents, or it could be something genetic, as well as environmental, stressful living conditions, childhood abuse, or school factors, which may be bullying, for instance. How to evaluate the students with EBD? Firstly, we need to look for the cues as discussed previously, then determine the nature and extent of general and special education and related services, and also carry out a direct observation of the behaviors, that what is the frequency of its occurrence, what is the duration, how long it lasts, is there any kind of latency that is present, and what is the magnitude. Also, we need to see that what are the settings in which it is occurring. It is across all settings or just one setting. Usually we carry out functional behavioral assessment or analysis. Here is just an example. There is a flow chart that you can read. It's self-explanatory. Here, this is a flow chart regarding behavioral characteristics, which is if there is general adaptive maladaptive index present or a make utilization of that, it will help us to see that whether there are internalized characteristics present or externalized characteristics present or not. Internalized would be that whether the individual is hurtful to himself or not, that is to self, and externalized would be that whether the individual is hurtful to other, to the property, has disruptive behaviors, or has unusual or repetitive behaviors, or socially offensive behavior is there, that is tends to offend other people or is defined to others. And third could be the asocial maladaptive index, which measures regarding the deviant behaviors. They may be withdrawal behaviors or inattentive behavior or uncooperative behavior. So we may carry out such kind of assessment or evaluation in order to assess if the problem behavior is there or not. This is just an example for problem behavior identification checklist. We have another example in which we are basically classifying the severity or degree of severity of the symptomology of the individual having EBD. It can help in understanding and teaching emotional disturbed children and adolescents that whether there is destructiveness, social functioning, reality index is there, insight is there or not, whether there is conscious control or not. Here again, a few examples of the possible signs or characteristics of behavioral disorders and emotional disturbance that may be cue for understanding or highlighting or identifying an individual with EBD. Let's just discuss regarding the behavioral problem. Behavioral indications of potential problem, indications of low self-esteem, disturbed relationship with peers, inappropriate relationship to the authority figures, other signs of emotional problems that may be there, emotional outbursts or throwing of the tantrums, deficit in speech and language, there might be difficulty in expressivity of the language, disorder temporal relationship, that is the relationship do not last longer, difficulties in auditory and visual perception, poor quantitative reasoning and computational skills. There may also be some kind of deficits in basic motor skill or movements. Here we have a list of indicators of social disability. Environment is very much significant, whether the environment is teacher control or school control. It may have other things which may have an influence onto the environment. Sometimes you find that the children have hyperactivity, they cannot sit still, they have distractibility and they have impulsivity. Assessment of hyperactivity requires obtaining multiple perspective on the youngster's behavior and context. We have rating skills that may be used and adequate assessment is also. The causal factors may be biological, family. Biological may include genetics, brain damage, brain dysfunction, malnutrition, temperament. Family factors may involve strict parenting or strict disciplining. Parental behavior is very much significant in determining or in development of school factors. School environment is not only critical important for social development, but it is also a factor over which the educators have direct. Cultural factors, there may be some kind of conflict among the cultures which may contribute to the problem behavior of the children. External pervasive developmental disorder that has distortion or a lag in almost all areas of development. For example, Rett's disorder, autism, Asperger's syndrome, and childhood disintegration. Autistic disorder is one of the very common one. It is a whole spectrum in which there is qualitative impairment of social interaction, communication and restrictive, repetitive, stereotypic pattern of behavior and interest in activities. The symptoms fall under three broad categories: social, communication, and conduct disorder, which is prevalent in 4 to 10% of the population. It is characterized by severe repetitive persistent patterns of behavior violating the basic rights of others or age-appropriate social norms or rules, including aggression towards people and animals, destruction of property, deceitfulness or theft, and serious violation of family or school rules. Self-injurious behavior, that is commonly known as deliberate self-harm as well. People tend to harm themselves in a brutal fashion in order to satisfy them. Juvenile delinquency is a legal term that indicates violation of law by an individual who is not yet an adult. There are a majority of youngsters who commit delinquent behaviors and a small percentage are apprehended. About 20% of all children and youth are at some time officially delinquent because sometimes they're very much indulgent in the risky behaviors. So that may make them prone to have juvenile delinquent behavior. Self-reported delinquent behavior is not related to social flag, but official delinquency appears more often among the lower social classes and sexual problem, promiscuous sexual conduct, that is having multiple partners and indulging in sexual activities, sadomasochism, that is hurting the other person and enjoying the sexual pleasure with that. Exhibitionism, showing the body parts of individual to others, and similarly incest, prostitution, fetishism, sexual relations involving the children. intense, excessive, and inappropriate masturbation, paraphilia, that is bizarre, perverted sexual behaviors, that is sometimes people have sexual activity with inappropriate objects. Substance abuse, when it is deliberate to induce physiological or psychological effects for others than therapeutic purpose, and with its use contributes to greater health risk, disruption of psychological functioning, adverse social consequences, or some combination of these are present. It is more and more becoming common due to the access to the substance that may make an individual. Sometimes children tend to also experience schizophrenia, in which the child may be having delusions, hallucinations, disorganized or catatonic behavior, and negative symptoms, that is, the lack of affect, inability to think logically, or inability to internalizing. Depression in children and adolescents is very much common. Anhedonia is present, that is, an inability to experience pleasure in all or nearly all activities. There is a disturbance of appetite and sleep, as well as there is the influence onto the weight gain. They may be having psychomotor agitation, loss of energy, feelings of worthlessness, diminished ability to think, and ideas of indicators of suicidal risk is required to be carried out. It is important to screen it. There are different kind of rating scales that also can be used. Suicide prevention, three measures are there. Limited access to devices, often used in impulsive self-destruction, that is sharps ko dur rakhein. Limiting the publicity given to the suicides, because extensive publicity is almost always followed by a sharp increase in the suicidal acts, because people tend to have vicarious learning or observation learning. Improving early detection of depression in children and youth is required. Anxiety-related disorders that are experienced by children and adolescents are obsessive-compulsive disorder, post-traumatic stress disorder, and OCD has obsessions. Post-traumatic stress disorder, prolonged recurrent emotional and behavioral reaction following exposure to an extremely traumatic event. Eating disorder may involve anorexia nervosa or bulimia nervosa or binge eating. Uh, Frequently, we see that there are important aspects which are related to weight and weight concerns, or the thinness concept of thinness and thinness perception is basically a root cause for building a thin. Thank you folks for watching. If you like this video, make sure to subscribe for more and like and share the video. Click the small bell icon that appears beside the subscription button to receive the notification the minute our video is uploaded. Thank you for watching. Allah Hafiz.